Welcome to Not Milk Never Milk. Subscribe if you're lactose intolerant.
You need to act now. Contact a dental professional for an urgent exam because loose teeth can indicate infection or trauma. Once called, start a soft food plan and avoid biting hard objects. This limits further movement. Make sure to switch to a gentle toothbrush and an alcohol-free antimicrobial mouthwash. This reduces inflammation and bacterial load around the supporting tissues. You're stabilizing the environment while you wait for clinical care. These steps lower risk and prepare your mouth for directed treatment. Once the immediate risks are reduced, focus on minimizing mechanical stress and inflammation. You should discuss a night guard or temporary splint with your dentist to stop grinding and let periodontal fibers recover. Meanwhile, apply cold packs for short periods to control swelling and choose anti-inflammatory nutrition, omega-3s and vitamin C-rich foods, because they support tissue repair. Make sure to eliminate habits that overload teeth like smoking, nail biting, or clenching. Reducing force is essential. You finish by arranging follow-up care. A periodontal evaluation and imaging reveal bone support and guide treatment. Once assessed, follow recommended interventions, professional splinting, deep cleaning, or other definitive care, because home measures don't fix advanced problems. If mobility increases, return immediately. That's a red flag needing urgent stabilization. As a final support, optimize calcium, vitamin D, and protein intake to aid repair. But avoid DIY splinting with over-the-counter glues. Improper fixes can worsen damage.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.